This episode is brought to you by Merrill. Join one of the most iconic names in wealth management, Merrill. You'll be part of a dynamic team of advisors and specialists working hard every day to grow their clients' wealth. And with the support of best-in-class research, advanced digital tools, and the resources of a global institution, it's truly an opportunity you can be bullish about. Learn more at careers.bankofamerica.com. Copyright 2024, Bank of America Corporation.
Good afternoon, guys, and welcome to the podcast. I've got a fantastic duo for you today. Natalie and Dr. Ellie Campbell coming from Georgia, and they own and operate the Campbell Family Practice Clinic, and they've also have a consulting practice that we're going to talk about. And I'm really excited to bring them on to share with the community the work that they've been doing in transforming their practice into a concierge, full service concierge, very successful, and as well as and be a great conversation for the physician entrepreneurs and those interested in concierge medicine. So welcome.
Thank you so much.
Yeah.
It's an honor to be here. Yeah, Natalie and I have worked together for a long time, I think 18 years now. So I'm a board certified family physician. I did conventional family practice for 13 years in a community health center, focused on evidence-based guidelines and following the best government guidelines for helping patients get to manage their chronic diseases. And over those years, I became a really efficient prescription writer, and I didn't make a lot of people get very much better. So I did a lot of soul searching of how to figure out how to change that and realize that really what I wanted to do was practice a more holistic approach. But if I did that, then I would talk to people about therapeutic lifestyle changes and diet and exercise and sleep, and I wouldn't get paid for it. I explored, furthermore, I was really interested in exploring bioidentical hormone replacement therapy as I was approaching my menopause and my patients were struggling with theirs. And so bioidentical hormone replacement therapy at that time wasn't really covered by insurance either. Now there's some ways you can do some of it within an insurance-based practice, but back then in 2005, there really wasn't. So I was convinced by my compounding pharmacist to start a solo concierge practice. And I was afraid to do that. So we started with a fee-for-service model in which patients paid me by the hour. And that was incredibly unsuccessful. For 3 years, my nurse made more money than I did. I had more patients than I knew what to do with. I worked myself to death 60 to 80 hours a week trying to scramble enough dollars together to make a living, and it still didn't work. In part because in those early days of my functional medicine practice, I spent so much time in the textbooks on the computer and talking to experts to try to decode the meaning of these deep dive personal labs that I was embarking upon. So in order to get good at that, it was a lot of personal time. So for every 1 hour I spent in front of the patient face to face, I was doing 2 to 3 hours of back work that they never saw. So my 1 hour of paid time actually had to be split by 4 hours of work. So that fee for service model just didn't work. And then Natalie joined me after about 2 years of doing that, first as a lifestyle educator, and eventually she worked her way up to be the manager of the practice. And now she's my indispensable right-hand girl that I can't do anything without because she manages all the difficult things in the practice. And we decided together to switch to a membership-based model, fee for care. And that was a game changer for us. So.
Yeah. And so you've been doing, how long before doing the time base to the fee for service versus the membership? What was the time?
About 3 years. Yeah, about 3 years. And every time I was just about ready to quit and give it up and say, I'm done, I can't afford this. It changed our family dynamic. At the time, my husband was full-time Mr. Mom, full-time at home. And when I started this model, I was like, one of us has to make a paycheck. So he went back to work. The kids went into daycare. It completely changed how everything we were doing. He's a school teacher. Without his support, this never would have happened. This never would have worked out. But when we switched to the fee for care model, even then we went through a lot of bumps in the road and it wasn't as successful. We undercharged for our services for a long time, but Natalie helped me realize our worth because we were changing people's lives. We're now 9 years into this practice. We've had 0 heart attacks or strokes in any patient that's under our care. because of the attention that we can give to the root cause of oxidative stress and inflammation. And of course, the oral systemic contributors that we're so passionate about. When we identify those early and correct them, our patients don't have events. And how much is that worth to somebody to not have a heart attack? And somebody who's already had one and been there, done that, or in somebody whose family history is so riddled that they live in fear all the time, to take that fear away and allow them to live their full life however God intended them to without the looming danger of a cardiovascular event. It's pretty huge.
Yeah. And a follow-up question I have for you is how do you, because obviously it sounds like you cut out the insurance, and how do you get patients to buy into this membership model? Because it's pretty much people are just there. The standard is like you have an insurance card and you go to these hospital or ER or urgent cares and you pay your copay. And how do you get that client base to start paying you for this?
That's a Natalie question because she's the world's best salesman because she believes in the transformations that she's seen. So take it away, Nat. Tell them what you do. What's your magic? You have a 90% close rate on our new patient meet and greet. So how do you do that?
I think it's exactly what you said. I live this and I believe it. When I'm in with the meet and greet patients, I tell them a few things. I have nicknames for Dr. Campbell. I call her the master of the human jigsaw puzzle. I call her the interdisciplinary collaboration specialist. I say she has the biggest black bag in town. But the one thing that we do better than any other practice that I know of is we love to care for our patients. And the care goes a long way. And what it means for one person may not be what it necessarily means for somebody else, but they know they feel welcome here. We try to create an environment where it feels like they're coming home to get medical care because most patients, let's just face it, it's not comfortable going to the doctor, right? You're not going there because you're like healthy and vibrant, and some of ours are, but for the most part, right, you're not. And so what can you do to alleviate that, make them feel the most comfortable and the most loved and the most respected? And I think when you do that, you're serving the patient. And when you're serving the patient, you're able to create a relationship that you either don't have time to do in another model, or you simply can't because you are so burnt out or tired and fatigued that you don't have anything left to give. And in this model, we do, and it shows.
Mm. And so it's interesting because we connected through Concierge Med today for the last 3 years now. And I love your presentations because you're talking about this experiential model. Like if you go into like a standard hospital, it's just cold and creepy and just very unfriendly. But you talk about the ambiance and putting things, talk about how you create an experiential experience. It really reminds me of like the tech companies like Amazon and Google and Meta, how they create experiences and to really create their brand.
I think experiences create connections, and connections builds trust, and trust means loyalty, and loyalty builds referrals. That's how it all works. And I think it starts, like I teach, like you saw me at the conference, it starts from the moment they drive by or pull in your parking lot. And we've really made a concentrated effort to make sure that it feels warm and inviting.
And to be fair, even that was several iterations. The first time when I first started practice, I office shared with another primary care family medicine doctor who accepted insurance. So we looked like every other primary care doctor in a medical strip mall with the gastroenterologist and the cardiologist all next door to each other. And it felt medical and technical. And we started trying to warm it up. It looked like a bachelor pad when we first moved in. So it started with putting furniture that had cushions and lamps instead of overhead fluorescent lighting and plants and pictures on the wall, right? So it started with some simple decorator touches. But even then, that didn't feel right to us. So we moved, because we were a retail business, we moved to a retail shopping mall. And we had upstairs in the office section of the mall, we were upstairs above the Chico's clothing store. But even that, as warm and inviting as we made it, and as wonderful as our stack stone wall was, and our water feature, and all the beautiful things that we had that made it feel warm, it still didn't feel like home. 5 years ago, we bought a house. I bought a house. And we converted it. Natalie did, really. It was her vision of what it was going to look like, and to make this house into your medical home starting from the landscaping and the parking lot and the decor inside. It's all designed not to feel like a doctor's office, but to feel like somebody's home where you're coming to get care. And that environment has really helped us to bring our practice to its highest revenues and its best population of patients who are here to receive the care we give.
Well, and I think it's also important to say that is not only patients, but I do that for the team as well. Because I want them come Monday morning, I want them to be excited to come back to work. I want them to be anticipating their schedule in an environment where they feel like they have some control and some say-so in what happens. Obviously, there's parameters and I set boundaries, but I'm going to lead with kindness and lead with love. And I think that carries over from the patient care to the staff, which then they bring that to the patients, and it makes a huge difference.
Yeah, and I would say no primary care or no concierge medicine doctor should care for patients unless he's also or she's also caring for their staff. And I don't necessarily mean they have to be your patients. There's some pros and cons of that on both sides, but you need to nurture your staff in a way that makes them feel like they're part of an indispensable team. Natalie, as my office manager, has been with me for 18 years. My phlebotomist has been with me
Well,
12 years. My RN has been with me 9 years. My front desk reception girl, 9 years. So we have longevity that's almost unheard of in primary care. And the reason for that is we create a work environment that's fun to be in, and we love and support each other through trials and tribulations, as well as celebrate joys and successes. It's part of what we do every day. And I lead my team meeting every Wednesday with tell me something good. That's how our staff meeting starts. Tell me something good. And we go around the room and everybody has to share something. I think that living in a space of joy and gratitude will carry over to the patient care. And it's definitely seems to.
Mhm. It's because I toured the clinic not last year, but the year before. You actually walk into it feels very homey. You don't even think it's like a clinic, or obviously there's the patient's rooms and you've got a
Exam tables and otoscopes.
yeah, it's almost, if you feel like you're in a wellness, very aesthetically pleasing and just very warm and cozy and lighting. And
Another thing that we did that brings that environment, and we're grateful because that's the exact image that we were wanting to portray. But another thing that we did here is we opted to not have Wi-Fi. It's a big decision.
Dr. Lisa.
We recognize that in today's world of chaos, all of this electromagnetic frequency is unsettling to our nervous system. And if we can find a way to take that piece out of the equation, at least for the short while where you're here in the office, and for our own sanity, I have some staff that's electrosensitive, that by taking that away and making a pleasant work environment, everything here is Ethernet hardwired. So if you want to use your iPhone here, we have to pass you an Ethernet cable and you have to plug it into your phone so that you can get a better signal. You can probably get enough spillover Wi-Fi from the hospital, which is a quarter mile down the street, to do some things. But if you want to download a movie or something, we'd need to give you a little more juice. So that sensation of calm is literally palpable in our office. And people comment on it all the time of how peaceful and calm it is here. And that's intentional.
Yeah. And I'm assuming when first transitioned, that 3-year transition and into that membership model, I assume a lot of the outbound was Natalie's work, just outbound. And I've seen your Facebook page and all of the social media, and now probably a lot of the clients come to you, right? I'm assuming majority of the clients, you don't have to do much.
To be honest, we never did much marketing. And every time we tried to spend money on marketing in the old fashioned tools, the yellow pages. That's how old we are. It wasn't the yellow page. It was local magazines, Atlanta magazines, high-end bridal magazines, because we were doing fertility work early in our practice career. Zero return on investment for any of those paper, radio, yellow pages, newspaper, None of that ever brought us.
Really are dating us.
What brought us, and even when we do our social media marketing things, that really doesn't bring us ROI. What brings clients to us is when I speak. If I go someplace and I present a topic, whether that's to a lay audience or a professional audience, I almost always come back to the office earning a patient.
Oh, wow.
They see me, they understand my authenticity, they recognize that I have some intellect and experience, and they understand that we're going to care for them in a way that they haven't been cared for before. And so we offer a free meet and greet appointment where patients can come to the office, take a tour, meet my staff. Natalie pre-screens them to make sure that they're a reasonable fit for my skill set. And then if so, then she invites me into the room. I speak to the patient for 10 or 15 minutes, hear their story, usually parrot back the symptoms that they're complaining of, let them know that I think this is something that I can assist with, something I have experience with, something that I'm interested in helping, and that they can listen to the rest of the story for Natalie to explain how the membership works. And then she goes through the nuts and bolts of how the practice functions and how the membership is and how much it costs. And she sells, if you want to call it that, a 6-month new patient membership package. And I would say 8 or 9 out of 10 patients accept it.
Yeah. Interesting. I also wanted to touch on this longevity portion because I've seen people just on these like just long lists of like 30 medications and just, it's incredulous, and it's just the healthcare system is just promoting this but you actually, what are your thoughts on longevity, and especially because you offer like the hydration, and I'm not sure if you do the peptides or any of those, but what are your thoughts on longevity and what people can start doing, just basic, and get off these medications, get healthy again?
I think that we don't advertise or promote ourselves as a longevity practice. That being said, cardiovascular disease is the #1 killer in our country. So if we can prevent that and take it off the #1 list, then we've already inadvertently extended people's lifespan. That with that in mind, what we do is we focus on fundamentals. Eat clean food and drink clean water and exercise and pray and meditate and spend time in nature and remove your toxicants and do something that provides great joy to you as a hobby, connection with others. And if we do those things and we get people off their ultra processed food and we identify their micronutrient deficiencies and we correct their detoxification pathways, magical things happen. Their blood pressure normalizes, their insulin resistance improves, their body weight drops, they normalize their liver enzymes. All these things begin to happen. And when we do that, those are recipes for longevity, optimizing all of the parameters that we see. Yes, we offer hydration therapy. Yes, we do IV vitamins. Yes, we treat chronic illness. Yes, we treat causes of oxidative stress and inflammation. And I would say that one of the things that we've truly become expert in is using blood, urine, and saliva markers to identify leading indicators of oral problems that are brewing that, if left uncorrected, will result in systemic illnesses, including cancer, including cardiovascular disease, heart attack, stroke, and even Alzheimer's. So if I can identify using my workup as a medical doctor, a problem that needs a dentist to partner with us, now we have a team of health professionals to extend that patient's lifespan without those complications of chronic disease.
Interesting. Yeah, it's one area that I've been really fascinated within, just especially the diet, the sleep, and the exercise, and just this area of biohacking. And I love to.
Yeah, and thermoneutrality, that's another piece that we are so lazy about. Americans, we probably spend 98% of our lives between 68 and 72 degrees. Whether we're in our car, our house, or our office, we're in this thermoneutral zone. And our bodies weren't meant for that. We were meant to experience extremes of temperature, hot and cold. And so if we're not going to get it in our life, just like we don't get sunlight, we have to artificially generate sunlight in our environments to get us some ultraviolet light in the right frequency to make vitamin D. we may need to artificially induce some thermal changes, hot saunas, cold plunges to get our body into that, out of that thermoneutral zone.
Interesting. Yeah, and I've read a lot of studies, like a lot of entrepreneurs. Yeah, a lot of my colleagues, they're doing these cold plunges, and I know a lot of the professional athletes, they do that to help them with their recovery. And briefly, I know because your time is valuable, we have around 3-4 minutes. Talk about what RevoPrac is, and because I know you have a consulting arm and what that does, and then how can people find out more about you and reach out to you if they wanted to get more information and advice.
People kept coming to me and saying, what do you guys do that make you so successful? I said, it's all on Natalie's shoulders. Natalie's the reason why I'm successful. So together, because of the impetus of our consultants, our nutraceutical reps, our compounding pharmacists, Natalie and I started to start a second business together called Revolution Practice. So now, why don't you tell them more about what we do?
And I think it starts from the passion that we have, because we realize that what we've been able to create is something that should be emulated, and other doctors should be able to do the same thing. Because what we're creating is exactly what you said earlier, Dr. Lou. It's an experience, right? It's making and bridging that connection. So we felt like if we had these tools, we knew what we did to build them and how to get here, then who are we not to share that so that other people could do the same thing? Because ultimately, it's going to do nothing but make the population happier, healthier. And what's your biggest commodity? Your health, right? So we're a dynamic duo, as you've seen on stage. So that's where we really love to be.
Yeah.
Yeah, and as much as the apps and the wearables improve our access to our data, I still think that most patients, most people really need a coach, a medical doctor at the head of their team. And we do that best in relationship. So while that might be achievable in an online experience, we believe that there's always a place for a brick and mortar with real people. And that's what we want to help people do, is create an environment in a brick and mortar environment where they support their patients through all of their challenges. And by the way, you can't give an IV online. So if you need an IV and we want to give you some vitamins and minerals, hydrogen peroxide, high dose vitamin C, whatever, chelation, whatever it is that we're doing to treat your underlying chronic illness, you got to come to the office. You might as well have a relationship with the people that are giving it to you.
And the last thing I'll say is this, is in doing what we do, we realize that the doctors have a lot of opportunities for CME. They have a lot of opportunity to reach out for support and for help and guidance and just places to put questions, but the staff really doesn't. And that's my passion, right? So I really wanted to be that support person for the building teams. And how do you redirect teams? And how do you create this system? And why do you need this form versus that form? And how do you bring patients in? And then how do you retain them? And so Revolution Practice was born also from that idea as well. We do have a website. You were asking about how to reach us.
Yeah.
So we do have a website. It's www.revolutionpractice.com. And on there, if you log on there, you'll see our beautiful little faces. And there are, under the service tab, we do all kinds of things, from one-on-one consulting to booking us for lectures for study groups or organizations. But I am there for your office team. So a lot of times the office managers and staff will want to talk to me instead of bringing it to somebody else or an organization. So it's a great one-on-one opportunity for team building.
Yeah, I really enjoyed that. And again, it was great to connect in Atlanta this year. And I'll see you next year, and keep up the work. And really excited to hear what you guys have in store for next year's talk.
Never know.
You never know what Michael's going to ask us to talk about. So whatever he suggests, that's what we talk about.
Keep up the great work.
Well,
We will definitely do that. Thank
Thanks
you
for spreading the word about concierge medicine and innovative approaches to better practices.